Good. So we'll cover formulating the research question, and we are going to be using a framework that is widely recommended in medical and epidemiological research for defining research questions. In this presentation, we'll look at what a research question is. We'll look at the importance of formulating a good research question. We'll look at some characteristics of a good research question, and we are going to dive into the PICO framework for designing an effective research question. Our hope is that at the end of this lecture, you should be able to apply the PICO framework to create effective research questions. And through a process where you break down the research questions using the different aspects of the PICO acronym, and then you can adapt the PICO acronym to different study types. Secondly, we want to help you understand the characteristics of a good research question. And we also have a framework for looking at whether your research question is good enough called the final criteria. So what is a research question? A research question, in simple terms, can be said to be a clear, focused, and specific inquiry that guides your study. And I know most people here have heard about the research question, but it's also important to look at how that differs from other aspects like the research topic, the research aim, and the hypothesis. So the research topic is usually a broader area, and you can have something like diabetes management. On the other hand, the research aim is usually a general purpose of the study. Like in the case of diabetes, you could have a research aim to explore treatment options for diabetes. A hypothesis is a testable prediction. And for example, in the case of diabetes, you could want to state a hypothesis that exercise reduces glycated hemoglobin levels in diabetic adults. As compared to all of these, the research question is really, really more focused. It is specific and it is very clear. So if we take the case of diabetes here, you see that our research question will be, does a 12-week aerobic exercise program improve glycated hemoglobin levels in adults with type 2 diabetes? If you compare it with the other aspects, you will see that this is more focused, is clearer, and is more specific. In this lecture, we are going to even go further into looking at the research question and how you can make it really clear, focused, and specific. At any point, if you feel like breaking, please do not hesitate to interrupt so that I can stay on track. Good. So what's the importance of taking time to formulate a research question? There are several reasons why. And the first is that once you have a research question well formulated, it helps to guide you in designing the methodology for your study. And a clear research question will help you to dictate the appropriate research design that you will need. Because if you define the research question very well, as you will see in the subsequent slides, you can infer directly from that research question the kind of study designs that will be appropriate, the ways that you can collect data, and ways that you can even conduct statistical analysis. Secondly, a well-defined research question improves clarity because a well-defined question will ensure that the research findings are relevant and they are interpretable. If you get the research question very clear, and you will see where your study is going to end, and you will be sure that you will not be wasting too much time on aspects that might not be contributing into the interpretability or the relevance of your study. Thirdly, a well-formulated research question helps you to maintain focus so that you're not just going forward, adding new aspects, subtracting aspects in the course of the study. And there are many concerns with this issue of focus. And without defining your research question very clearly from the outset, you can easily stray out of the main direction that you want to go or that you need to go. And lastly, a good research question that is well formulated helps you enhance efficiency. Because the question is very specific, it is streamlined, you can go directly into literature review and find exactly what you need. And this saves you time. Even in terms of data analysis, you can be clear about what exact data analysis methods you are going to be using. And this helps you to at least operate within time frames. Usually, everyone doesn't have unlimited time to work on these things. And so getting the research question right from the outset is critical for you to ensure that you are being efficient in that process. So now let's go into the core of it, which is this framework called the PICO framework, which is a widely um, recommended framework for designing research questions. So you notice that we have TS in brackets. You're going to see why we add TS and what the elements of TS are. So PICO is an acronym that stands for population, which represents the P, intervention, the I, C, the comparison group, and O, the outcome. So let's look at what each of these represent and what you need to kind of ponder about as you try to figure out what aspect of each of these aspects of PICO you're going to be focusing on. So the first P in PICO is population. It also includes the patient or the problem of interest. So to be able to define this first aspect of PICO, you have to ask yourself, who is the population of interest for my study? And another way you could ask it is, who is the patient? Which patient am I interested in? What are the characteristics of these populations? Is it a people of a particular age? You might be looking at infants, adolescents, elderly people. Is it a particular group, maybe women, maybe men? Are you looking at hypertensive patients? Are you looking at people living with HIV? It's very important to really be clear. And this aspect of PICO helps you to define that population very well. Another thing that the population component of PICO does is that it helps you to kind of start formulating the eligibility criteria, particularly with respect to the study participants. Let's look at the next aspects of PICO, the intervention. Also, sometimes you can just call this the exposure, and you're going to see why we can also call that exposure. So what will be the intervention? And what will be the exposure? What are going to be the factors that you want to study in this study? And usually for interventions, you can always think about maybe it's a drug that you want to give to the participants. It could be some form of therapy. It could be surgery, psychotherapy, or some form of behavioral therapy. You could just want to administer a diagnostic test and then you study it. And in cases where you are not really administering an intervention, you have to ask yourself, what is the exposure of interest? For example, you might want to look at whether smoking causes cancer, right? In that case, you might want to look at people who smoked before you assess their outcome, which is cancer. The next element of PICO is comparison. So the C stands for comparison. And for this aspect, you ask yourself, what is the alternative group that I'm comparing with the intervention? So what alternative? And usually for clinical trials, you can have something like a treatment, and then you compare it with like a placebo, or you can have a treatment and a control group. You could have a standard of maybe a diagnostic test, and then you have a gold standard you're comparing with against a gold standard. And if the study is one where you're looking at an exposure, so you can look at, for example, people who smoked versus those who did not smoke. So this comparison aspect ties directly with the intervention or the exposure. So are you looking at an exposure? What are you comparing that with? So as I said, it could be a placebo, it could be some standard of care that you're looking at against the treatment. It could be that there is no intervention at all. So you look at people that you intervene, and then this comparison group will be that you do nothing. The last but not the least component of PICO is the outcome. So the outcome is what result that you intend to measure. What is it that you intend to measure? And something that I'll be adding relatively new here, which I think is very important, even if you have seen PICO, you might find this interesting, is measure, the measurement of interest. What aspect of the outcome do you want to measure in terms of how the intervention or exposure influences it? So we have outcomes that could be clinical outcomes like morbidity, mortality, the patient's quality of life. It could be risk increase, risk reduction. or even epidemiological outcomes like things like prevalence, incidence, all of them fall under outcomes. There are two other elements, aspects of time. Remember, I said we'll look at what T and S stands for. So the full acronym kind of goes something like PICOTS. So time, for the time aspect, you ask yourself, when are you doing this study? Is it in 2014, 2026? Is it a period between 2012 to 2020? Is there going to be follow-ups? Are there going to be follow-up periods? You have to consider all of those elements as you frame your research question. The last aspect is the setting. You cannot just talk about the research question without being specific about where you're going to conduct the study because it has very huge implications. A study that is done in the whole country is more expensive, it's more difficult, it's less feasible. And so being specific about where you're going to conduct the study also helps in defining a research question that is clear and is focused. So before we go further to really look at specific examples, it's also important to note that PICO framework kind of changes depending on the type of research question that you are interested in. And here you have 6 types of broad areas for research questions. And I can overall categorize them into 2 categories. You have questions that are generally descriptive in nature, and then you have questions that are kind of inferential or analytical. And descriptive questions are the kind of questions that you're just like asking yourself, what's happening, right? Describing something without comparing it, just describing it as it's there. And analytical or inferential ones are the kind of questions that you're comparing one group versus another. And as you notice, when you start talking about comparison, you start maybe having like an intervention versus a control group, people who are exposed versus people who are not exposed. And so that distinction is very critical. And we'll see how the different aspects of PICO change as the kind of research type changes. For example, for typical descriptive questions, the focus will be what's happening. And in those kind of questions, you are just interested in 2 key components of people, which is the population of interest and the outcome. And this is very typical of typical cross-sectional studies that are looking at measures of frequency like prevalence, maybe an incidence or some trends. And so you will not need to look at the intervention, you will not need to look at the comparison. So maybe along the line, as I was making this presentation, you might have been wondering, what if you are not really maybe doing an intervention? In that case, the PICO framework kind of adjusts itself and you only consider the components that are relevant for that type of research question. The second type of research question are questions that are looking at a etiology or the cause of a condition. And so you ask the question, what causes this condition? For example, what are the causes of cancer? And one of them, you could be more specific and say, does smoking cause cancer? And so this is kind of like, is smoking a risk factor or a cause of cancer? It's a causal question, an etiological question. And for these kind of questions, you have to incorporate the different aspects of PICO, all of them. And so that includes the population, the intervention or the exposure, the control group, and the outcome, which is the disease that you want to look at. For the case of questions that are diagnostic questions, their focus is generally on the question, how accurate is a test? And so you always have the population, you have one diagnostic test that you want to compare against a certain standard. And the outcome here is kind of what's the accuracy? How is this more accurate? Maybe how is the diagnostic test more accurate than the standard or the test you're comparing it against? For questions that are of prognostic type, you're looking at what is the likely outcome. And for these, you have generally a population, you have an exposure that they were exposed to, which we also call a prognostic factor. You want to compare that prognostic factor against another group, which could be like people who do not have that prognostic factor or the absence of that prognostic factor. And you look at outcomes, prognostic outcomes like survival, recovery, and so on. For questions that are kind of interventional or maybe like some form of therapy, you might want to ask, does this treatment work? right? And in that case, you look at the population, you look at the treatment, you compare it with the control group or the placebo, and then you look at the different clinical outcomes. The last type is questions that are qualitative in nature. And generally, qualitative questions kind of ask the question, what are the experiences of the participants? And you can see they are also kind of descriptive questions. So they only focus on the two aspects of PICO, which are the population, and the outcome here is kind of some phenomenon like the experiences, the perceptions of the patients. And PICO is not really a very good framework for qualitative studies. As you are going to see down the line in this program, in this module on qualitative research, you will look at the SPIDER framework, which is more adapted for qualitative studies. Now, let's dive into something more practical to take some examples of questions. And for each type of question, we see how we can refine a question that is quite vague into a question that is clear, is focused, and that is appropriate for you to maybe share with colleagues to start exploring and to maybe start going for ethical approval. So consider a question, for example, a descriptive question that asks a vague descriptive question that goes like, what is the burden of panic disorders in Bafia, right? So for this kind of question, what will be the population? We can say we want adults aged 18 to 45. So you're thinking clearly, who exactly am I interested in studying? So we can say, for example, want to look at these adults of this age group. So is there going to be an intervention? This is a descriptive study, purely descriptive study. So we are not going to do any intervention. Is there going to be a comparison group? No, we are not going to have that. And what is going to be the outcome? And so we can look at particular outcomes here, like the panic disorder in this case, and the metric of the panic disorder that we are interested in measuring is the prevalence. So now that we have this, let's look at when, or what time frame. So maybe we want to just look at the prevalence in 2024 and exactly where's the setting. In our case, is Bafia. So by outlining all of these different aspects very clearly and defining them, you start to see that your research question becomes more clear, more focused, and you start to see whether this is something that is feasible and who are you going to be including in the study, where are you going to be doing it, what exactly are you going to be measuring. You can see this really helps to focus the question. So now that we've passed our vague question through the PICO framework, how does it look like? See the refined question here. What was the prevalence? So that's the measure of panic disorder in adults aged 18 to 45 years in Bafia, Cameroon in 2024. This is a far more effective question as compared to the vague one, which is above. And you can see how PICO framework kind of gives you a systematic approach to refining the research question in ways that they are more focused, they are more clear, and they are more effective. If you share this research question to a statistician, to a methodologist, or to some other colleague, they can actually start having very good ideas as to whether this is doable, what could be done, what would the study design, where are we going to study, collect data, what data collection methods are we going to apply, and so on. So let's move on and we look at the second type of studies. And so this will be interventional studies. Let's take a vague question. Now you could say, does fluoxetine help with depression? This is quite a vague question, right? And so we ask ourselves, what population do we want to study? So we could consider adults with moderate or major depression. So you want to know whether this helps. I mean, it's good to take people who have depression and study them. So we take people who have moderate to major depression. What will be the intervention? In this case, it will be the fluoxetine, which is a treatment for depression. And we want to compare it against something. So what are we comparing with? We compare it with the other treatment, and a treatment could be behavioral, right? It could be a psychotherapy, like cognitive behavioral therapy. And we look at the outcome. What outcome are we interested in? We look at, and there are several different outcomes. And the beauty of PICO is that it helps you focus on the outcome that you want to measure out of the so many different outcomes that are possible. And in this case, we could take an outcome like health-related quality of life. And what aspect of health related quality of life in terms of fluoxetine's influence. We want to measure the effectiveness of fluoxetine in influencing health-related quality of these patients. And so this aspect of metric is something that I think this presentation adds compared to most available information on PICO. They don't really focus too much on the metric or the method. And by adding the metric or the method, it really streamlines the question and make it even more precise. So under what time frame? We want to do this for 12 months. So give people fluoxetine, follow them up for 12 months. And under what settings are we going to do this? So we can say for our Nigerian guys who are on the call, we can say we are studying this in a psychiatric clinic in Abuja. So I'm going to give you guys a couple of seconds to kind of formulate what the refined question will now look like um, after we've passed it through the PICO framework. Let me give you a few seconds. You can drop your answer in the chat. Give you a few seconds. So look at this answer. Say in adults with moderate major depression in a psychiatric clinic in Abuja, does fluoxetine improve health-related quality of life more than cognitive behavioral therapy as measured by effectiveness over 12 months? So you could still frame this different and say maybe something like among adults with moderate to major depression in a psychiatric clinic in Abuja, is fluoxetine more effective than cognitive behavioral therapy at improving health-related quality of life over a period of 12 months. So it doesn't really matter. You don't have to write in a very specific way. The key idea here is that you ensure that the different aspects of PICO as relevant to the study types are clearly stated. So let's look at another example and for questions that are etiological or causal in nature. And let me say, you might know some people that smoke weed. And people have asked the question, does cannabis cause mental health problems? Right? We could take this a vague question. We could also take it and break it down through the PICO framework to see how we could develop a question that is more better. So we take a bunch of healthy adults who are maybe aged 18 to 45, and we should have a reason for choosing that age group, right? So you always have a reason to justify why you're picking a particular age group or a particular population or a particular segment of a population. The intervention here you take, or the exposure here will be the people who smoke cannabis, and you want to compare them with those who do not take cannabis, right? And the outcome of interest will be a mental health condition. You can't just study all mental health conditions. There are thousands of them. And so the PICO framework helps you to choose a particular outcome that you will be narrowing down on. And so you can choose something like psychotic episodes, and the measure of the outcome will be something like incidence. So you want to see maybe people who consume cannabis versus those who do not consume cannabis, follow them over some time and look at the incidence of psychotic episodes. And so we could do this over their lifetime. You could do this, maybe you could just study this for 5 years, a year, depending on your resources and whether it's the feasibility of the study. And let's say we are studying this in Douala. So now kind of type in the chat what you think a refined to better research question will be um, with respect to the PICO framework. Think about it. I'll give you a few seconds. I'm seeing in the chat, someone is asking, please, do we worry about the length of the research question? I think it doesn't really matter that much. So the key idea here is to be able to formulate the research question in a way that it's precise, effective, and is focused. It can help you to actually build a research question that is going to be you can operationalize and you can conduct in your environment and you can move on without wasting time. So what do we have? Anyone have any questions? Or maybe you have something in your head? Oh, okay. Yeah, so we have a question from Prof. Don. What about the length of the study time? Yeah, so I'm thinking about lifetime here, but it could be shorter. So maybe this I call lifetime studies will be the studies that will go on for a very, very long time. Maybe a more appropriate time frame will be maybe within 1 year, 2 years, you know. Yeah, so let's look at the research question that is better. So a better research question will be something like, in healthy adults aged 18 to 45 in Douala, does cannabis use increase the incidence of psychotic episodes as compared to no cannabis use over their lifetime? So you can see how the different aspects of PICO kind of help you narrow down and streamline the question into something more effective. We are not yet done. We still have a couple of other study type examples. Let's look at the next diagnostic questions. Here is a big one. I don't know, there are women on the call. We probably have done a pap smear. I strongly recommend it. So you might wonder, is the pap smear effective for cervical cancer screening? So this is quite a big question, right? But it could be a starting point for you. And so we say, what population are we interested in here? Who are those who get cervical cancer screening? Cervical cancer is something for women, right? So cannot include men. Men don't have services. So we talk about women, and we might narrow down to women who are between 25 to 65 years. And what intervention or diagnostic tests are we interested in here? Pap smear. Do we want to compare it with something else? Yeah, compare with visual inspection with acetic acid, which is another method for screening for cervical cancer. And what outcome are we interested in here? Of course, cervical cancer. And the metric that is critical here for assessing the diagnostic test against the outcome is the accuracy. We want to know the accuracy of the diagnostic test. So under what time frame? Maybe we could just do this once patients are showing up at the clinic during their routine screening. Like we have these as public health campaigns. So we could just study that during that period. And we could study this, we could take maybe a particular setting like in Yaoundé, we're doing a community-based screening, or maybe particular hospitals in Yaoundé. So with that, think through it. What would the refined question look like? Drop yours in the chat. Aha, Prof. Don is asking another very nice question, which is, does it matter if the women have had HPV vaccine? Yeah, I think that's a very important consideration that should be going on through your mind in terms of the population. And I think it would matter. It definitely matter. Maybe if it influences the way that you assess the accuracy. Yeah, good. We have some people dropping in the chat. Okay, so I'm going to put what I think will be an effective question. So a refined question compared to the vague one above could be, in women aged 25 to 65 years in Yaoundé, is the pap smear more accurate than visual inspection with acetic acid for detecting cervical cancer during routine screening? So let's look at the last but not the least, and these are prognostic questions. So we could have a poorly or vaguely phrased prognostic question that goes like, Does poor medication adherence worsen hypertension outcomes? So here the prognosis hypertension outcomes. So what will be our study population? Yeah, we take a bunch of people with hypertension. Could be adults if we want to be more specific. And the prognostic factor here or the exposure is whether they're adherent to treatment, and we want to compare them versus those who are not, who have good adherence. So the prognostic factor of interest is rather poor medication adherence, and we want to compare that with people who have good medication adherence. And the outcome here is whether they develop strokes, and the metric or method is some form of likelihood. So you can think of what is the likelihood of medication adherence influencing hypertensive patients to develop stroke somehow. And likelihood is also like odds. And if you're already a little bit advanced in study designs, you can start thinking about what type of study designs can permit you to look at the likelihood of poor adherence leading to stroke, and start thinking about what study designs, what data collection methods, what follow-up periods, and all of that just at this stage. So what time frame? Maybe we do this within 3 years. I think that's sufficient time for you. It might not really be, but 3 years might still be adequate for people who have some degree of risk. And we can do this in Kigali. Our friends from Kigali who are in the call study this in Kigali. And so a refined question will be something like, among hypertensive patients in Kigali, does poor medication adherence increase the likelihood of strokes within 3 years compared to good adherence? So compared to the first one, you see that this is a better question. From here, you can think about this feasibility or study design, ethical concerns, and all sorts of things. It's more clear from this question as compared to the initial one. So the last one is qualitative questions. The PICO framework is not really a great way to assess qualitative, to refine qualitative questions, but we can still kind of use it. It's not the best, but we can still kind of use it in qualitative question settings. So we have a vague qualitative question like, how do cancer patients cope with treatment, right? So what patients are we interested in? We have to be clear about what type of cancers. There are like so many different cancers. So we might be interested in breast cancer patients. And remember, this is qualitative questions are quite descriptive. So there's no intervention, there is no comparison group. And the outcome here is for qualitative questions is a phenomenon. And the phenomenon here is coping strategies during some kind of treatment. And we can be specific with, let me say, chemotherapy. And the method that we use here is the focus group discussions. And we want to do this at the current moment. And we might want to do this in the cancer unit at the Douala General Hospital. So what will be the refined question? Drop them in the chat. And while you're thinking, must you always have, someone's asking, must you always have the PICO when constructing the refined question? Like I mentioned, depending on the type of question, some aspects of PICO might not be applicable. And we've seen this for descriptive questions where the intervention or exposure versus comparison aspects are not applicable. Otherwise, for diagnostic, interventional, etiological kind of questions, all the aspects of PICO are quite applicable. If you are doing your small prevalence cross-sectional study, you might just want to focus on the population and the outcome and the measure that you want to use for assessing that outcome. Yeah, so what will be our question? Yeah, a better question will be, what are the coping strategies of breast cancer patients attending the Douala General Hospital? Does chemotherapy as analyzed through focus, during chemotherapy as analyzed through focus group discussions? So these are the different ways that you can formulate questions using PICO, depending on the type of question. So now that you supposedly have a good question or a better question, it doesn't end there. You have to go further to still think and brainstorm hard on whether this question is really a relevant one. Is it good enough? And again, like the PICO framework, there's another criteria or framework for doing that called the final criteria for evaluating research questions. And the first F in final stands for feasible. Can the study be conducted with available resources and time? Let's say, for example, you are a student doing your thesis and you define a beautiful, nice PICO framework based question that is quite specific and clear and that needs 4 years and needs like $4 million to realize. I mean, that's not practical. You don't have the money, you don't have the time. So you must really define a question and ensure that it is feasible, right? The next aspect is you have to choose a question that is also quite interesting for you. You must choose a question that is interesting because this is quite is a subjective criteria, though, because means different things to different researchers. But overall, if you find a question that is quite interesting, you will be able to at least be interested in working on it. Your drive will be higher. You're more likely to do a thorough job. And this interesting also relates to the research community. They are usually at every given point, there are questions that are hot topics, that are interesting topics that people are curious about. Like, for example, in HIV research, people are worried about cure questions. People are wondering how NCDs interact with HIV. They are really interesting questions of that nature. So you might want to do work that is quite interesting, is quite current, you know. And the next aspect of final criteria is novelty. Does the question address a new aspect or area or an aspect that is under study? And so this novelty also something you will not always have like do a purely new thing, right? So novelty could still mean your study is adding to current literature, is clarifying conflicts because there can be literature that shows that it goes in one direction, there are other studies that go in the other direction, and your study just aims to kind of to clarify those discrepancies. And also, novelty could mean that you are adding something new to what other people have already done, or it could mean you are totally adding something totally new. You are starting a field all by yourself. So, a novel research question is an interesting question. It's a better question than one which is typically repeating work that other people have done, wasting resources, wasting your own time, and not adding so much to the research community. And the other aspect, which is critical, and I'm insisting very critical, that the ethics committee would be very concerned about and that you should consider early on before you start writing your protocol is the ethical implication of your question. So you must ask yourself, is the study ethically sound and respectful of your study participants? You can have a nice question that maybe wants to look at whether if you expose people to maybe a treatment that you expose maybe, let me say, people for an intervention that they could contract HIV, for example. And in that intervention, you might be worried, what if it doesn't work, right? What if the treatment is has a very low effectiveness? There's a very huge ethical concern here. So these are things that you must think very clearly about. And this is particular for clinical trials and interventional studies because you might be exposing the participants to a very huge risk. So that is something you should take very seriously. The last aspect, our final criteria is relevance. Is your study relevant? Does the question address the current knowledge gaps and practical needs? So this is quite related to interestingness. And so relevance, work on something that is relevant, that contributes to the field, and that fills knowledge gaps and not just repeating what other people have done. So in conclusion, a well-formulated research question is key for the success of your study. And the PICOT framework helps you improve focus, feasibility, and impact. And you should always ensure that you look at your research question from the lens of the final criteria. And if I can summarize this talk and give a takeaway message, I will say that a well-crafted research question is like a compass. It guides every step of your study and ensures that you reach the destination that you aimed for. So thank you very much. These are some references that I read through and that I recommend you could go deeper into on this topic of formulating research questions. And I have an assignment here. It would be nice that you also practice this after the lecture, so you can just choose a broad area of interest for yourself. You first state quite a vague question and then use the PICO framework to refine it. And then you think of justifying each aspect of the PICO as you put it. Why am I studying this population? Why am I choosing this intervention? Why this comparison? And all of that. And then the last aspect is you can share it in the WhatsApp group so that the other peers can maybe give you feedback. So thank you very much. Let's listen to some questions or comments. But before that, we'll give the profs on the call the opportunity to first of all give comments. Profs, over to you guys.